YouTube, here's another update. In post hiatal hernia surgery and TIF repair and recovery. This video will focus specifically on medication. Won't take that long, I don't think. Back when I first started having acid reflux, I mean, I've had acid reflux, I guess, for a long time. Forget, that, just common. Before Zantac was pulled off the shelf, my wife and I would take it, pretty regularly. Just, having a night of something too spicy, or who knows, whatever that would be, that would cause that acid reflux. My wife and I would have a Zantac or whatever. So sometimes it's pretty bad, sometimes it wasn't all that bad, but common, I'd say, acid reflux, and you're kind of asking for it by what you eat, kind of thing. Many years ago. Nothing else. But about I think it was like 2018, 2019, I don't remember, but started having some issues where I'd have bouts of really bad acid reflux where days at a time. I remember I went to a conference, came back, and that night, it was a Friday night, I had pizza, and then I really had a bad acid reflux for several days there, and it was even until like Sunday or Monday the following week. And doctor says take a PPI, over the counter. What is it called? Prilosec. So I'd have a Prilosec, and maybe have it if I planned on having like a spicy pizza or something spicy to eat. I'd take a Prilosec like on a Wednesday or Thursday, and then take it Wednesday, Thursday, Friday, Saturday, and then stop, kind of a thing. But it was just small doses, and that's what the doctor told me. Whether that worked or not, or works or not, I don't know, but that's what the doctor told me. So I did periodically, and then as I knew I had a problem, is like almost like to try to get out ahead of it. And again, my understanding of that Prilosec, or the PPI, proton pump inhibitor, I believe it's called. The Prilosec is the over-the-counter, the Meprazole, which I believe is the official name, that one the doctor would give you. And I think the over-the-counter is only like 20 milligrams. But anyway, I would take that as needed, pretty much. And then, things started to get worse. It was in the fall of 2020. Really bad. Started having other issues. I'll make a symptom video later, more specifically, but now I guess, since I'm kind of talking about it, started having some common symptoms. But for me, water breath, nausea. For me, I didn't really have a ton of heartburn that I was used to down here. I had throat burn, more of a laryngopharyngeal, LPR reflux, silent reflux. Google it. But again, medications, Prilosec, Zantac, and the PPI, the Prilosec wasn't working. Go back to the doctor. Ultimately, what happened is, why are you having all this nausea, and so on and so forth. They do an endoscopy and find the 3-centimeter hiatal hernia. No other issues that they could speak of, just the hiatal hernia. No ulcer, no other damage, just the hiatal hernia. So take PPI. PPI I took, again, let's call it from September or so through October, maybe November, give or take. But I started having some different unusual side effects. They diagnosed me with a my mind went blank, a eustachian tube ear. Google it, a eustachian tube dysfunction. When I laid down, it wasn't like I got a lot of acid reflux types of stuff. I kind of did, and burning, but it was again more up in the throat, but it was in my ear, and my ear really hurt. And then I just didn't want to be on a PPI. I know what damage it can cause. Do some Google searches if you want to know. And that's just what I did. And I tried to look at more specific medical stuff too. But I know it can cause potential damage long term. And again, what's long term? 6 months, 6 years. I mean, I think it's more like years than months, but I just didn't want to take it. I was like, there's got to be another fix for this. And in addition, I just, understood how that could be problematic with some other stuff that I won't mention. So again, I just didn't want to be on the PPI. I just did not. So I went off of it, and weaning off, or I didn't even wean off. I went off immediately, and it was bad. So I'd suggest if you're going to wean off, if you're going to go off of PPIs, go slowly. Follow what a doctor would say. Don't just stop cold turkey, because it just like floods, opening the floodgates of acid reflux for you. Just awful. For me, it was. So, and you could probably find that information. So, started a PPI, off for the PPI. It was around October, maybe November of 2021. And then, okay, well, I'm going to try some other stuff. So, try natural remedies and stuff like that. Just with apple cider vinegar, pills. I can't remember, but it was a nature's made type of thing, and apple cider vinegar and maybe turmeric and something else. I can't remember what was in it. But I was so terrified of taking anything, even a supplement, that it was just going to make things worse. Because medications, PPIs just caused me some other issues, and I just didn't have all these other issues before. I just didn't want to continue on it. So I eventually talked to a surgeon. He says, do a Lynx, Google LINX if you don't know, Lynx, or take the PPI. Because he said, I'm trying to remember what he said about the Nissen fundoplication, but anyway, I wasn't really happy with that doctor and what that surgeon had to say, so I ended up going to see a different doctor, and they eventually, long story short, they ended up recommending the TIF and the hiatal hernia repair, like the dual process procedure. So, but anyway, went off the PPI in November, give or take, and then I started again trying natural remedies, supplements here and there, but not a ton. But it was more so trying to push my stomach down. And I forget the name of the lady that I saw on YouTube, but again, you can see natural repair of hiatal hernia, Pam something, I don't remember. I looked at her page and saw some of the things she did to push her stomach down, and breathing, and anxiety is a huge part of this, by the way. Just decided to move and get up a little bit. Try easier said than done. Get your anxiety under control, and all that kind of stuff. Breathing. But anyway, I tried that. PPIs, natural, some supplements. Didn't really do anything. Tried to push my stomach down. Breathing, meditation, and I tried, which helped. Was a plant-based diet. I didn't go the whole foods route, the whole food plant-based diet, but I did buy a lot of Morningstar and Qurn, Quorn type of products. Pop it in the microwave or in what's it called, a toaster oven or something like that, or the oven to bake, and replace your chicken and your meat and stuff like that. So I didn't have a ton of meat, which isn't necessarily a bad thing, but it just wasn't for me. I just felt like I wasn't enjoying food at all. For some, it might not be a problem, but I lost about 10 pounds because I just didn't want to eat. I was just not enjoying food at all. But I tried, but I didn't want to do it. So I went that route, and no medications, no PPI, no nothing. I would take Tums, Rolaids, Pepsid, those, the other common ones. Gaviscon, the liquid was very helpful. Gaviscon, liquid. So Gaviscon was very helpful. Doctor recommended that because it coats the throat. So take it before a meal or something like that. And even if I wasn't having anything spicy, because I really was very cautious, I didn't have tomatoes, I didn't have anything that was a trigger. And for me, it was a lot that was a trigger. So I'll maybe talk about that more later. I didn't mention that in the foods, the diet that I mentioned the last time, because that was more of a what can I have now, but not what I had avoided. But I avoided a lot of stuff that would be a trigger. Tomatoes, spicy foods, anything with tomatoes, a tomato-based pizza, spaghetti, you name it. So Gaviscon, Rolaids, these mint ones seem to work pretty good for me. So things like that I'd have. And then I was feeling pretty good at points. I think my anxiety was a large part of this, but I was feeling pretty good at points. But then I remember my brother came up to help and do some work around the house, and I just had a major jump off a cliff, and I just felt that throat burn, and it just was so debilitating and so disheartening. And because I was at a point where I was like, oh, maybe I'll cancel my surgery, which was scheduled for July, and that was like maybe 40 some odd days before that, so into late May or June. Excuse me. And like I'm gonna go through with the surgery. So I ended up doing that, but I tried as much as I could, and I didn't even have it that long. I know some of you have been dealing with 20 some odd years, 10 years. I don't know how you did that. Um, but I just couldn't take it anymore. So, and if I knew that there was a solution out there that I could do and I could enjoy my food and not be miserable and not feel symptoms all day, because at my worst, I was feeling symptoms 95% of the day. It was just bad. And sometimes it was lesser and other times it was really bad, but awful. I just wanted to be normal and feel normal and eat normal as much as I could. I'm still cautious, like I mentioned in my last video, but still. So, yeah, PPIs, stop those. Still take Tums, Rolaids, Gaviscon, Pepcid, which was rare. Pepcid was rare. I don't know why I didn't take that one. I just didn't. Again, concerned of it was too, not that it's a PPI, because it's not, as far as I understand, but I just didn't want to take it for fear of it doing something like the PPI did and causing other side effects, which I didn't want to deal with. So I just didn't do that, and I took the Tums and Gaviscon and Rolaids. But there's nothing wrong with Pepcid. I think if it works for you, take it. So it's just a different medication and acts differently, I believe, on the stomach. I'm not an expert, not a doctor, not advocating for what you take. Talk to your doctor, but again, that's what I did. So eventually, again, I didn't take any other medications. I just I did it the natural as best way I could. Took a Rolaids, Tums, Gaviscon when I need to, when I had a really bad flare up. But I tried to stay away from it. It wasn't like I was popping them every day, but so when I had bad days, I might have taken, I think the maximum you take of these is like 7 per day, and I might have taken 4 or 5. I never got too close to the 7, but 5. I mean, that's kind of close, I guess, but that's all I did. So, and since the surgery, I have not been on a PPI since November-ish of 2021. I refused to take it. I just didn't want to take it. I'm not going to take it. So I know that was a question recently asked by somebody that's following my content here, but I have not taken a PPI. I will not take a PPI again. If I had to take it, it would be like a short-term thing, but I wouldn't take it long-term. But I haven't needed to. The surgery was successful to an extent. So I'm not on any medications. When I need a Rolaids, I take one, just like anybody else. Man, that was too spicy. I take that, whatever it might be. And sometimes it's just like, what did I just eat? And maybe it was a tomato base, or maybe it had something in it I just didn't realize and it got to me. But that's normal, I'd say. It's not something that was abnormal. In any case, also, after the surgery, this leads to another medication, which, again, disclaimer, I'm not a doctor, I'm not a therapist, I'm not telling you what to take, I'm just telling you what I took based on what was my situation and what my doctor told me to do. So after the surgery, it was about day 17, if I'm not mistaken, post-surgery, I had, again, a falling off of the cliff, and it's like the worsening of symptoms beyond what I had even before the surgery, which was awful, and it continued for quite a bit. So I was kind of on that restricted plant-based diet still for a long time, and I was still on restrictions. I couldn't eat steak or bread or anything like that was chewy. So finally got past that 6-week mark, that 42-day mark, and I still was having issues. The doctor said, be patient, be patient. So I think it went 17 weeks post-surgery, and I still was having issues, and I was not normal. This is not normal. Come on, you got to be kidding me. But they kept on saying, be patient, be patient, be patient. Okay, fine. I talked to the second surgeon, and he said, no, that's not normal, this far out. Okay, another endoscopy. And the endoscopy said, everything's fine. The TIF held like it was supposed to. Nothing's wrong. Everything looks good from an anatomical standpoint. He even told me this ahead of the endoscopy. If it isn't damaged, if it held like it was supposed to and nothing popped back open, then I'm assuming it's your parasympathetic nervous system, and we can calm that down with a medication, which was called amitriptyline. Again, not a doctor, not advocating, just telling you what worked for me. That is what calmed my parasympathetic nervous system down, was amitriptyline. I believe it's also a medication that's used for some depression and things like that. And again, I don't know exactly what it's for. I don't really care. All I know, doctor told me that it would work, or thought it would work. Let's try it and see if it would calm things down. And within a couple days, problem is gone. So that medication for me worked out very well. So
Another time, not a doctor, not advocating, not telling you what to take. But again, if your parasympathetic nervous system is ramped up, mine was apparently ramped up, then calm it down with that medication. So it worked, and I've been taking it ever since. So since I think December 2nd, December 3rd of 2021, I've been taking amitriptyline. And I think it's a small dose. It's only about 10 milligrams or so, or whatever. But again, not a doctor, not advocating. That's what worked for me. Ask your doctor. It worked in terms of that. So again, did the surgery work? Did the medication work? Was it a combination of the two? I don't know. Like I've said before, I don't care. I just wanted normalcy, and I have it for the most part. I'm not perfectly normal, but again, I'm getting older. I'm not old. I'm 42, but I have problems with the stomach just like everybody else that starts to get older. You can't eat what you did when you were in your 20s. You just can't. It's just you're asking for it. So I'm careful, and I still have my magic medication if I need it, but I don't. It's very rare that I have to take it. So now I might have symptoms 5% of the week versus 95% of every single day. So for me, I feel better, and that's what I took in the way of medication. I'm on other medications for other things I won't get into, but the amitriptyline specifically was for this calming of the parasympathetic nervous system down and getting that under control so the symptoms go away. For me, nausea, water brash, and sour water taste, which essentially went away. For a while there, several weeks, again, post surgery, water tasted awful, like soap. It was disgusting. I couldn't drink water, and it made nausea worse, of course. So this medication really helped that. So now I don't have water brash. I don't have, occasionally, I might have some of these things again, but I don't really have nausea. I don't have water brash. I don't have a sour water taste. If I do, it might be some other issues that are related. I had a concussion, like I mentioned, and is it nausea from acid reflux? Is it nausea from a concussion? I think it's concussion, but in any case, that little pill had helped me, and I feel pretty good. So again, I don't know what worked. Was it the pill? Was it the surgery combination? But now again, as I mentioned in my diet video, I'm back to a normal diet. I eat anything I want whenever I want and so on. So that's in a previous video. This one was more about medications and that situation. So hopefully that explains it. I'll get to the next video, maybe symptoms, and get into more detail with some symptoms. I kind of mentioned it in this one, but I'll break that down a little bit more in maybe another video. And what I was going through, that will probably be a quick one, but and I'm kind of mentioning it here again. But either that and then I'll get into some. I know people have asked about exercise and stuff like that, so I'll get into that too. So have a good one, everybody.